routinely देना चाहिए so as to protect them from tonsil cancers and other malignant oncogenic viruses. और ये routinely हम लोग 3 डोज दे सकते हैं, जिसको हम 0 मीन्स जैसे आज किसी को आज दिया, सेकेंड डोज विल बी आफ्टर 1 month and third dose will be 6 months. So that will protect them from the all oncogenic viruses. So that is the main reason how. So कैंसर जो होते हैं ईएनटी कैंसर प्रेजेंट कैसे करते हैं, दे आर वेरी इजी टू डायग्नोज. उनके लिए कोई बहुत ज्यादा उसकी जरूरत नहीं है कि लाइक वी नीड एंडोस्कोपी और इन्वेजिव प्रोसीजर. सो दे आर वेरी इजी टू डायग्नोज. फॉर एग्जांपल अगर पेशेंट के पास ईएनटी कैंसर है तो उसके क्या लक्षण होंगे, व्हाट विल द सिम्टम्स. सिंपल, इन माउथ इफ समवन इज सफरिंग फ्रॉम माउथ कैंसर ही विल सफर विद दैट नॉन हीलिंग अल्सर. एंड अगर कोई भी मुंह में अल्सर है, इफ दैट इज नॉट हीलिंग फॉर मोर देन 2 weeks, इफ इट इज परसिस्टिंग, that means that could be highly suspicious for cancer, right? So initial stages mein tongue cancer will never have pain. So once it advances, then the patient will experience pain. So that is important. Any ulcer in mouth which is persisting beyond 2 weeks, उसमें कैंसर हो सकता है. अपने नियर एंड डियर जो भी ईएनटी स्पेशलिस्ट हैं, आप उनको मिल सकते हैं, उसको एग्जामिन कर सकते हैं. सिमिलरली थ्रोट कैंसर, इफ समवन इज हैविंग चेंज इन वॉइस, सबको सर्दी जुकाम होता है, कोल्ड होता है, उसमें भी वॉइस चेंज होता है. बट इफ उनको अपने ईएनटी स्पेशलिस्ट के पास जाना है, वो ऑफिस में बैठे बैठे जस्ट विद इन 1 minute ही विल डू एंडोस्कोपी विदाउट एनी सेडेशन, विदाउट एनी एनेस्थीसिया, और उसको सब पता चल जाएगा वेदर दिस इज अ कैंसर और व्हाट. एंड अपार्ट फ्रॉम दिस, इफ देयर इज एनी सॉर्ट ऑफ लंप इन नेक में फेस पे कोई भी लंप है विच इज परसिस्टिंग बियॉन्ड 2 weeks, just one simple needle testing that will reveal everything. So that means for to diagnose the ENT cancer, it's not that big issue कि हमें कोई बहुत बड़े बड़े टेस्ट चाहिए, वी नीड एंडोस्कोपीज और इन्वेजिव प्रोसीजर. नो, on the basis of symptom and on the basis of examination which we can easily do in OPD, we don't need any sort of admission, so we can diagnose them easily. And if we diagnose these cancers well in time, we can provide them quality of life, right? So these are the ENT cancers जो ऐसे present होते हैं. They can present like the ulcer like this and ulcer like this. Similarly, sometimes the ulcer like this, then ulcer, they might present ulcer like this. These all are cancers, ENT cancer, mouth cancers. You can see here, these all are cancers. Then okay, so similarly I have already discussed कि throat cancer कैसे present करता. They will present like change in voice, difficulty in swallowing, sometimes persisting throat pain which is going to ear. That might be one of the presentation of cancers. How we treat cancers? So conventionally जितने भी ENT cancers होते हैं, they are treated with surgery only. ओके, सो हम एक्स्ट्रा क्या प्रोवाइड करते हैं फोर्टिस हॉस्पिटल मोहाली में, व्हाट एक्स्ट्रा वी आर प्रोवाइडिंग कि जो पेशेंट को श्रीनगर से वहां आना पड़े. आई विल टेल यू व्हाट वी डू. सो फॉर एग्जांपल इफ समवन इज सफरिंग फ्रॉम अर्ली स्टेज टंग कैंसर, तो उसमें नेक डिसेक्शन भी होना है. सो नेक डिसेक्शन में क्या होता है, दे मोस्ट ऑफ द पीपल दे विल ट्रीट दिस विद अगली लुकिंग स्कार्स लाइक दिस, बिग स्कार्स. और हमें मालूम है दिस एरिया इज एक्सपोज्ड, एवरीवन विल जज यू just because of your look. So if you provide such a big ugly looking scar, so patient को अच्छा नहीं लगे, उस quality of life will be deteriorated. So what we do at Fortis Hospital Mohali, we do robotic neck surgeries, that is robotic infraclavicular approaches, what we call RIA, R-I-A. So where we give 3 incisions, 4 incisions, this incision approximately 1 centimeter collarbone, and then we approach from here. We can see we have inserted robotic ports here, and then we ascend from this area up into the neck. So you can see there is no scar in neck. Whatever scar we have given, this scar is in chest wall only. And if you see here, there one small pipe, we put it here, and on next day we discharge our patients. And blood loss is just nothing. Sometimes we can't see even a single drop of blood. And this is how our robot system work. So this is a robotic arms, they are attached over there, and our assistant will be somewhere here. This is a vision card for the my assistant, and then I'll operate, I will manage all these robotic arms from the surgeon console, this area where I will sit. And if you see how nicely we do treat these patients, can you see there is hardly any bleeding, there is no bleeding at all. If you see here, we can nicely see platysmal fibers जिनको हम बिल्कुल भी कट नहीं करते हैं, and you can see there is hardly any no bleeding at all, right? And this is how we treat. And if you see, even after completing surgery, You can see here there is hardly any bleeding. We can see all structures nicely from inside. And similarly is the surgery neck dissection which we do. So you can see here this is a case of tongue cancer where we have done neck dissection through robotic approach, and we can nicely see there is hardly any bleeding. We can easily give such a magnified view. So there is hardly कोई भी कैंसर सेल बच नहीं सकता है, और कोई भी नोड जो है ना वो बच नहीं सकता है इसमें. We can nicely see how nicely we can find out vessels, big vessels in this area. So this is a big vessel area. We can nicely dissect them. So you can see there is hardly any bleeding. Even you can't see even a drop of blood over there. See how nicely we can just take it out. There is hardly any bleeding. So hospital stay jo conventional whatever neck dissection conventional if we do, so hospital stay will be 3 to 4 days. Here the we are going to discharge patient. So you can see how nicely we can take out everything. There is hardly any bleeding. And if you see, these are the incisions. One is incision 1, incision 2, 3 and 4. Incision 1, 3 and 4, they are all are half of centimeter length. Whereas the middle one is 1 centimeter, because whatever we resect, we have to deliver this specimen from this incision. So that's why we have to make it little bit big. That is 1 centimeter. And these are my patients. This is one patient where I have done neck dissection. This is day 7 when he came to me again for first follow-up. You can see these are the incisions. There is no scar in neck at all, which will make patient ugly looking. So there is no scar. Similarly, again another patient, there is hardly any scar in neck because we have done surgery from the chest wall. So one more question is कि सारे patient क्या robotic surgery के लिए ideal candidate है? No, it's not like that. So I have already emphasized as much कि जितना जल्दी हम stage disease को diagnose करेंगे, so जितने भी robotic surgery हम लोग करते हैं, by and large majority of the indications are only early stage lesions, that is T1 to T2 lesion. अगर T1 T2 lesion है, N0 lesion है, in those cases we can do robotic surgery, और जैसे patient हमारे पास आया था वैसे ही patient वापस जाता है. For advanced stage tumors, robotic surgery in head and neck is not an indication. So in those cases we do conventional surgeries. And then apart from these, then another one